First on the budget, big and bold is how you described it. Billions go into education,
Right.
to salmon, to the homelessness, a long list.
Yeah.
What about the idea of some kind of a tax cut, even if it is temporary? The state has this cash right now. You know people are calling for that. Did we ever look at maybe some sort of a tax cut or a rebate?
Well, look, when you're in the middle of a crisis, which we are, we don't have one crisis, we've got 5 or 6. We have a homelessness crisis. We have a mental health care crisis where kids aren't getting mental health. We have a salmon crisis where salmon are going extinct. We have a crisis in education where we don't have enough counselors for our kids who have mental health problems. When you're in the middle of that type of crisis, we need to buckle down and take care of our people, and that's what we're doing. And to think that we can run off willy-nilly with one-time money, yeah, we got money in the cash till right now, but it's one time. It's coming from the federal government only once. And I do think we have to be responsible, and this is a responsible budget, because it socks away $1.5 billion into our savings account so we don't have to raise taxes later if there's a downturn. We're trying to get back to an even keel. That's where we get in this budget.
Another thing that folks are hoping for, some relief with the long-term care fund that goes into effect in just a couple of weeks. Everyone's paycheck, for the most part, will be impacted. There's talk of delaying it. You've said that you would be open to maybe backing some changes. Any chance that gets delayed, or will we see that January 1st?
There is a chance. I'm talking to legislative leaders about that. I think we might have more to say about that in the next few days, as a matter of fact. There is an appetite to refine and improve this bill, and we're talking to legislators about how to do that. So I feel pretty good about having some resolution about that.
Do you have the authority to do that? Because as you mentioned before, it doesn't really fall under COVID. You could argue that people can't afford it maybe like they could a couple years ago, but
I don't have the legal authority because this is not related to COVID in any way. But the legislature can make some changes, and I do think there's an appetite to refine and improve this, to remove some of the objections that people have to this plan. So I feel good that we will have a resolution, hopefully in a few days.
I wanted to ask about Senator Doug Erickson. Have you heard from him? Do we know where he is, how he is? Is he expected to come back next month?
I have no further information other than what is in the public realm. People are just not sharing information, and obviously we hope that he is okay. This is obviously a very dangerous disease. The press reports are that he certainly contracted in that. Beyond that, I really don't have any information. I hope he's okay.
Okay. Another topic this week, one of the commissioners from the Fish and Wildlife Commission resigned, saying that the commission was a place of political quagmire. We're waiting to speak with him about a little more as to what he means, but did that surprise you when you hear that? This didn't used to be a super controversial commission, I don't think.
It did surprise me, actually, and so I have not had a chance to talk to him about it. I actually don't think it is a surprise to us that there is controversy now, more than there used to be, because we're losing our stocks. Salmon are going extinct if we do not act. Coming back to one of the things I said, we need to make these investments so salmon do not go extinct. And that's one of the reasons that I've proposed this budget that I have. If salmon are going extinct, obviously there's going to be fights over the last salmon. That's not what we should be fighting about. We should be working together on how to restore salmon runs. And that's what I hope the commission helps us do.
All right, let's talk about Omicron. Should we expect any announcements here heading into the holidays? What would it take for some new restrictions to be put in place, or is that something you're even contemplating at this point?
Well, we don't have anything in the immediate future that we're contemplating. There may be some new rules around high school athletics. We're having this outbreak in wrestling. We do want to have more people wearing masks, certainly when they're watching the game. And I think it makes sense to have our kids tested more frequently before they go in these competitions. So I think you'll hear from the Department of Health in the upcoming days about that. But listen, we're all waiting with bated breath to get the scientific assessment of Omicron. But here's what we know today. No matter what we learn tomorrow about Omicron, here's what we know today. Number one, it makes sense to get a booster. This is a big deal right now. It's always good to get a booster. It's a lot more important to get a booster now because we know Omicron is going to be much more transmittable, and it could spread like wildfire through our community. So it really makes sense to get a booster. We really want people to double down on that effort, and obviously their first dose if they haven't had any. And it makes sense to wear a mask. because this is extremely transmittable. This disease is doubling every 2 days in some countries that are ahead of us on this disease process. So we got the things we know that work, let's do them, and let's be smart and use science.
And do we need a little more information on the hospitalizations or the death rate before we look at some of those things that we talked about a year ago?
Yeah, we're going to need to know more about this disease to see if there are additional measures. But I want to repeat, when you have a tool that works, don't wait, use it. You know, we got a hammer to nail this thing, use it. And that's the vaccine, particularly boosters. Only about 40% of our people who are eligible have got the booster yet, so we encourage them. We've got additional doses coming into the state now, so we'll have adequate supply. That's what we need to do right now.
You mentioned the high school wrestling. Why not just put those matches on hold? I mean, there are dozens of cases that we know about from just a handful of these tournaments. We're just early in the winter season. I know you're a big high school basketball supporter,
right.
But do we need to take a pause on that, or what might be called for in that realm?
Well, I think we need some additional measures, and I think if we test these kids the morning of the competition, that could be significant improvement to prevent infections. And I believe you're going to see a requirement to that in the future. That's not a done deal, but I think that's coming. It makes sense to have masks of people in the gym. We need people, when you go see your child to play, put a mask on when you're sitting in the stands. Don't infect other people. Don't infect your neighbor's kid. Come on, help out here a little bit. And that's the kind of thing we need to be doing.
Okay to have full crowds at Kraken games. You brought that up today. The Seahawks maybe could make the playoffs. A few more home games for them. Any restrictions that you see that we need to start thinking about?
Well, I think the Kraken have a really good protocol of requiring vaccination or testing. They require masks to be worn, and that has shown to be quite effective. We've had very few outbreaks in our sporting venues that have in fact enforced these requirements. That mask really works. And so where people use it, where the administration makes sure that happens, it can keep people safe. I think we're in the right track on that.
Just about a week away from Christmas, New Year's is coming, lots of holidays. What are you recommending for folks this year? We talked last year about putting things on hold. What should people do, in your opinion, this year when it comes to family gatherings and parties?
Well, that's largely a personal choice. What I would think is, A, get a booster. If you've been vaccinated, get a booster. And if somebody's coming over to dinner, you might say, hey, have you got your booster, Charlie? And Charlie says no. And I said, hey, how about getting a booster and then come over, right? This is an opportunity. Here's a great holiday gift. Save your uncle, save your cousin, save your friend. And so encouraging people to get the booster, get the vaccine, that's helpful. Use masks where you can. If you're eating, obviously you can't. And just help each other be safe. I think those things make sense.
Personal question, but will you be with your grandkids? I know we heard so long ago, early days of the pandemic, that you weren't able to see the newborn, the little one.
Right.
Will you have a chance, have you had a chance to be back together in person with them?
Yeah.
And what?
Yes, I see my grandkids. They're vaccinated. We're just thrilled that now they've all been able to get vaccination. What a blessing that our children can be safe like this. And so we're very happy about this. They're conscientious, they wear masks. They think it's the right thing to do to wear masks at school. They're totally, the kids get this, right? They're the smartest people in our society, and they get this, and they accept this, and they want to be safe, and so far we've been lucky. And but we're paying common sense measures.
Is there an end in sight? I mean, we're about to start a new year. We all thought that 2021 was going to be the new year.
Right.
It's just a big question mark, or can people expect at some point to not worry about masks and vaccine mandates?
Yeah. Look, there's no certainty in this world, right? But I do believe, number one, there are things we can do right now to reduce our risk, and I hope everybody takes them. But number two, there is a significant possibility that we will be free of this in 2022 if Omicron is mild enough that it takes over from Delta, but then doesn't cause major severe illnesses. That possibility exists. It's only a possibility at the moment, but there are some early signs that it is milder. But we don't know that for sure yet. Now the problem is it also infects people 2 or 3 times faster. So this is a juggling act. It affects a lot more people, but perhaps people get less sick. We don't know where that net balance is, but we do know this: we can't allow our hospitals to become overrun. We still have to be able to get a heart attack treated, or a car wreck, or get a new hip. We still have to have functioning hospitals, so we have to do things that the hospitals are not overrun. But yes, I do believe there's a real possibility that we will be in much better shape this time next year or earlier. I do believe that.
End of the year, everyone always looks back and says, oh, maybe I should have done this differently. Any regrets? I mean, we rolled things back there June 30th. Your vaccine mandate caused a lot of people to leave state employment. Any regrets about how you handled this in 2021?
I really don't. I don't think regrets are really helpful to drive in the rearview mirror to start with. But you mentioned this issue of our vaccine mandate. This has been very successful. Look, we have saved, if you compare our death rate to, say, Mississippi, we have saved 17,000 people in this state. I think saving life is one of the best things you can do as a human being. And the policies that we've adopted have saved 17,000 people. 17,000 people are going to be able to enjoy a holiday dinner this year where they would have not been alive otherwise.
And you're basing that on?
I do not regret at all decisions to save 17,000 people. So these things, I think, have been effective. We fortunately only lost about 3 to 3.5% of our state employees, and our schools are open, and our hospitals are functioning, and most all of our state functioning is occurring. So we made decisions to save lives. I don't regret that in a heartbeat.
And that 17,000 number, is that per capita based? You compared it to?
So if we had the same death rate per 1,000 people as Mississippi, we would have lost another 17,000 people, okay? More than double the number of people that we have lost. Now, 17,000 people is what, a third of Husky Stadium? That's a lot of souls. And so I don't regret helping to save them for 1 second. And fortunately, we have people who have complied largely. They've accepted these. They know they want to save lives just like I do. Doesn't mean they're not tired of masks. I'm tired of masks too. But I think we should keep saving lives.
And I said last question, but you brought up the success of the mandate. Do we need to add boosters to that? Does fully vaccinated now mean 3 shots?
So it's something we can consider. We are waiting for further guidance from the CDC. We've tried to make when we have done things, we've tried to make it parallel to what the CDC has done. They're investigating this decision right now as to what nomenclature to use. But I know this, they are saying, I am saying, every doctor I've talked to is saying, get a booster, save your life, save your cousin's life, it's worth doing.